Okay, good evening, everybody, and welcome to today's session. Today is going to be focused on learning more about the connection between air quality and health. So one of the greatest impacts of air pollution has to do with its effect on health. So both at the individual and the community level. So this is really one of the reasons why we are doing this campaign, to be able to educate people in our networks around the effects of air pollution and health, and also based on the importance of safeguarding health, ensuring safe and healthy environments. We also do some advocacy, around enforcement and around public policy. So for us to be able to do that effectively, we need to arm ourselves with the requisite knowledge and skills. And so to help us learn more about the nexus between air quality and health, we have two of our air quality champions running today's workshop. We have Mr. Abdul Muktar from the University for Development Studies in Tamale. He's a lecturer in public health. He's also had wide experience in community advocacy and also various projects. So he will be talking mainly around indoor pollution and health. We also have Mr. Kelvin Yeboah from Breathe Accra project, who is also a research assistant at the University of Cape Coast, also talking to us mainly around outdoor pollution and health. But considering that health is a very central topic, obviously there will be some areas of overlap between the two presentations, but I think that this also creates a lively platform for discussions, questions, etc. And I know that in many of the spaces and connect meetups that have been hosted around this topic, health has emerged as a very important theme. So I'll hand over to Abdul Muizz to start with his presentation, and after he's done, he'll hand over to Kelvin. So whilst the presentations are going on, feel free to post your questions, and also, if necessary, also raise your questions. After Abdul Muizz's presentation, there'll be an opportunity for some quick questions, two questions, and then we move over to Kelvin. After Kelvin's presentation, we'll then have more time for extensive discussions. So over to you, Abdul Muizz.
So thank you very much, and welcome to today's. My name is Abdul Muktar, and I'm with the UDS School of Public Health. And I'll be said by Gameli. I'll be co-presenting on this topic on air pollution and health with Kelvin. So impact on human health. Can we go to the next slide? Presentation will be in this format. We'll be talking about what air pollution is, factors affecting the quality of air as a result of pollution, then measuring air quality, health effects of pollution, significance of monitoring air quality, then various ways we can improve on the quality of air. So we move to talk about what air pollution is. Can I move to the next slide, please? Next slide, please. Okay, so various definitions of air pollution has been given, and various descriptions of air pollution has been given. So we will say that air pollution refers to the presence of harmful or excessive quantities of substances in the air that we breathe. And these substances can be pollutants, either coming from natural sources or human activity, or from man-made or human sources. Next slide, please. Some say that the pollution is naturally the introduction of harmful substances in the air that are capable of compromising on human health and also ecosystem health. So in understanding the quality of air, air quality refers to the condition of the air. That is the condition in which the air is, and we usually measure the pollutants and gases that are present in the air and which can affect human health and the health of the environment. So we have other living organisms in the environment apart from human beings or living beings. And so we don't just look at how when the air is compromised, the effects on only the human being, because there are other living organisms that also depend on this natural resource for their well-being. So we look at how that can also affect the health of other beings or other living organisms in the environment. It's very important to monitor the quality of air in the environment. I always tell my students that if it is water, if the quality of water is compromised, as a human being, you have an option. You can either refuse to take the water and look for a better one, or you can treat the water that is polluted before you can take it in. But for air, I'm not sure there's anybody in an environment who will say that, oh, because this air, the quality of this air is compromised, I'm not going to breathe for the meantime. Probably I'll not breathe for the next 2 hours. And when I get better air, then I breathe. I'm not sure any human being or any living organism do that. So it means that it's very important for us to be concerned about the quality of air and also to monitor the quality of air to ensure that the quality is not compromised at any point in time that may affect human health and the health of our ecosystem. So regular monitoring of air quality is crucial to identify potential health hazards and take also necessary steps to be able to mitigate whatever pollution sources that are compromising the quality of the air. And if we don't do this and the quality of the air becomes poor, there are consequences or effects that we are likely to face. And we have that poor air quality can lead to respiratory problems. It can also lead to cardiovascular diseases and other serious health effects, particularly, especially in vulnerable populations like people who have underlying health conditions, most aged people, and also young people whose systems are still developing. It's very important that we always ensure that the quality of air is checked to ensure that we protect these vulnerable people in our ecosystems or in our populations. Next slide, please. So we already mentioned that there are factors that can influence the quality of air or that can pollute the air that we breathe in. that we term as air pollutants. And these air pollutants come from varied sources, various sources including industrial emissions, vehicular exhaust, and also natural events also contribute to deterioration of the quality of air in our environment. Meteorological conditions, for instance, weather patterns and atmospheric conditions also play a significant role in the dispersion and concentration of these pollutants in our environment, and this can impact on air quality. For instance, excessive wind can disperse these pollutants into our environment. Other weather conditions can also help to ensure that there's distribution or dispersal of these pollutants in our population to be able to target us. Also, geographical locations. The location of an area such as, for instance, proximity to industrial zones or urban centers can also significantly affect the air quality in that locality or in that region. So even in our own communities, there are certain communities you live in and you cannot be sure of the quality of the air around that environment. So where the vicinity or the locality that may also compromise or may also lead to expose you to harmful substances in the air based on the activities that go on in that locality, among others. Next slide, please. So, how do we improve on the quality of air, especially for public health and also the health of the environment? We can take up regulatory measures and policies. Government regulations and policies are very essential in controlling emissions and enforcing standards to improve air quality for public health. We have a lot of laws and regulations that targets many sectors of our environment, but sometimes the challenge is the enforcement. I monitored the discussion that was going on the air quality ambassadors platform regarding the work of environmental health officers in our various assemblies. Sometimes there are a lot of factors that affects the way they do their work. Some of them were discussed on the platform, and so it makes it very difficult for them to enforce most of the bylaws of the assemblies, the various regulatory policies and measures that should be enforced in our populations to ensure that we are safe from all environmental factors. So regulations and policies are good, but also we have to follow that up with commitment to enforcing these regulations and laws to ensure that we are actually doing the right thing. Also, promoting sustainable practices. Some of the activities that we undertake that leads to compromising the quality of air should also be looked at. So we should encourage sustainable energy use. We should encourage green transportation and also waste management, proper waste management. All this can contribute to reducing pollution of the air and also improve the quality of it in our environment. Most waste, especially solid waste, it plays a vital role in the quality of air that we have. And if we manage our waste, especially solid waste, properly, we can also reduce the percentage of pollutants in our environment and also in our air, and that can also help to improve public health. Then community involvement and awareness. In all cases, We should engage communities as we are doing now in initiatives that raises awareness about air quality issues and also promoting individual actions that can lead to positive changes in public health. Currently, they are encouraging uh, tree planting and also green environment, which is very, very important in reducing pollutants in the air. So we can continue on that tangent. And also various actions by individuals in our communities that can compromise the quality of air. In engaging these communities and creating awareness, it will help a lot to improve the quality of the air for our health. Next slide, please. So various factors, as we mentioned, affect the quality of air. We've talked about them. Natural factors, and we also talked about the individual or various activities of human beings that can also affect the quality of air. The natural factors include the weather conditions and also the geographical locations. So natural factors like wind patterns, temperature, and also altitudes can impact on air quality. For instance, mountainous areas may have cleaner air due to less pollution in those areas, and also there's less activity going on in those areas, and so they may have less. They may have more quality air in those areas. Then we have vegetation and wildfires. These are also natural causes. Presence of vegetation can help to purify the air by absorbing the pollutants, as I mentioned earlier. Then wildfires can also release harmful particles and gases into the atmosphere. So what we can do is to encourage more vegetation and reduce the incidence of wildfires in our vicinities. Then other natural causes, we have volcanic eruptions, dust storms, among others. Natural events like volcanic eruptions and dust storms can also introduce large amounts of especially particulate matter and other gases that can impede on the quality of air over a wide area where actually human beings live. So these are some of the natural factors that can affect or influence the quality of air. Next slide, please. We can also look at some of the activities of human beings that can affect the quality of air. For instance, we talk about the anthropogenic factors, including industrial emissions, vehicular emissions, and other agricultural practices. These activities, for instance, the industrial activities, release a lot of pollutants like sulfur dioxide, nitrogen dioxide, particulate matter, among other things. And when we talk about improving our lives, our governments talk about one district, one factory, one this, one that. We should also be mindful about some of the effects of these improvements in our lives that can economically help the country, but also release some emissions to our environment that may also go a long way to compromise the health of the population that we seek to improve. Vehicular emissions, including exhaust fumes and particulate matter, are also a major source of air pollution, especially in urban areas where most of these vehicles are. And in agricultural activities, including livestock farming, use of fertilizers, all this can release ammonia and other pollutants in the air, which can also contribute to the presence of pollutants in the air. and thereby affecting the quality of it. Next slide, please. So now to narrow down to indoor air, there are a lot of issues relating to activities that go on indoors, either in our households or in other indoor places that are not open places or outdoor places. That can also affect the quality of air in those places. It is said that we spend a lot of time either in our houses or in our workplaces or in other indoor places. I think the last time I checked, about 80% of our time is spent indoors. If we are not in our houses, we are moving to our offices or other places that are usually indoors. And so when the quality of air at indoor places is compromised, the effect of it will be so much on us because of the time we spend in indoor places. So indoor air quality is also very important and which we should look at. For instance, some building materials and other furnishings at indoor places can affect the quality of the air there. Materials that are used in construction and furnishings, like even painting or the paints that we use, adhesives, furniture, all that can release volatile organic compounds and that can compromise the quality of indoor air. Also, we cook and engage in heating activities also in indoor places, and cooking appliances and other fireplaces and heaters can produce indoor air pollutants like carbon monoxide, nitrogen dioxide, and particulate matter. And then other household cleaning products like cleaning agents, air fresheners, and pesticides also do emit chemicals in the air that can compromise the quality of air and become risks to people who occupy these indoor places. Next slide, please. Now, how do we measure the quality of air to be able to tell whether the quality has been compromised or not? Next slide, please. So it's very important to be able to measure the quality of air at any point in time. And as I mentioned earlier, measuring it will determine whether it has been compromised or is beginning to be compromised and becoming detrimental or posing as risk to human health. So one way we can measure the quality of air is to do health impact analysis or health impact assessment, where we are able to measure, assess the impact of polluted air on human health by helping to identify potential risk and also protect the well-being of human beings. So when we conduct health impact assessment, we're able to tell whether the health of individuals have been compromised and whether it is as a result of exposure to pollutants in the air. For instance, we can use measurement tools like we can do for something like pulmonary function test or lung function test to be able to tell whether the lung function has been compromised, and in that case we can use other invasive methods like blood tests to be able to tell which chemicals or substances had polluted the air that has gone in to compromise the work of the lungs. So health impact assessment can help. We can also do environmental monitoring by using measuring aids or measurement aids in monitoring the environment. This helps us to be able to identify pollutants or pollution sources and such that we can implement mitigation measures to stop those pollutants from becoming a risk to human health. We can also use policy development. Accurate measurement of air quality provides essential data for policy. So when we measure the quality of air, it helps us to be able to take policy measures and regulations that will mitigate whatever negative effects air quality or air pollutants to be able to protect public health. Next slide, please. So these are the various techniques that we can use for air quality measurement. We can do sensor technology advancements. There are a lot of advancements in sensor technology, and this has led to the development of innovative air quality measurement techniques. And this has enhanced the quality, the accuracy, and real-time monitoring capabilities. So that's why we live indoors and outdoors to be able to check for any hitches in the quality of air and to sometimes even report on how far the quality of the air has compromised. We also use remote sensing methods. So remote sensing methods like satellite and aerial monitoring also offer valuable insights into air quality measurements across large geographical areas. And this can also complement the ground-based measurements or air quality monitors to be able to give real-time data on issues of air quality. Also, data analysis and interpretation. Sophisticated data analysis and interpretation methods also helps to show up our understanding of air quality measurements and to inform decision making. So when we collect this data, it's also very important to be able to analyze the data and make meanings out of it for better decision making in mitigating these pollutants. Next slide, please. All right. So next slide, please. All right. So we have some challenges that has been identified in these measurements, and we have complex pollutant interactions. Air quality measurements encounters challenges in assessing complex interactions among different pollutants, requiring comprehensive analysis and modeling techniques. So if you have an air quality monitor that, for instance, can monitor chemicals in the air, there could be some other pollutants like biological pollutants which may not be able to be measured by the monitors that we have. And so it brings about complex interactions in terms of that. Also, some of the pollutants interact with each other. And this makes it very difficult for the monitors to determine which specific pollutant is around. And you know, when certain substances react with each other, they turn into other dangerous or volatile substances. And so you need very complex mechanisms and monitors or machines to be able to separate these pollutants and to show real-time evidence of their presence. Also, spatial and temporal variability of air quality also presents challenges in establishing representative measurements, and this necessitates strategic sampling and monitoring approaches. So these challenges in spatial and temporal variability, where because of the weather patterns, among others, can move certain pollutants from one source to another would also mean that you have to apply sophisticated techniques like sampling, air sampling, or using air samplers to be able to separate these pollutants and also measure them as they should be measured. Also, integration of multi-source data. There are also some of the challenges. Data from diverse sources like ground-based stations, satellite observations. Now we are talking about remote sensing, among other things. All poses challenges for ensuring that the data is very consistent and reliable. And this calls for more sophisticated methods to be able to accurately measure and provide reliable data for decision making. Next slide, please. There are a lot of health effects of poor air quality on human health, and we shall look at a few of them. Next slide. We all know that in one way or the other, we can be affected if the quality of air is compromised. The major aspect of the impact on air pollution is respiratory compromise or respiratory system or respiratory disorders. This increases the risk of asthma, or it exacerbates the effects of asthma on people who already have asthma. And also, we talked about chronic obstructive pulmonary diseases. When we are exposed to those pollutants, it can worsen the case of such patients. Then other respiratory infections from particulate matter and other pollutants can also. Then one of the permanent or major effects of air quality when it's compromised is lung cancer, which can give us long-term, or it can arise from long-term exposure to air pollutants. So it can lead to development of lung cancer. Next slide. We can also have other effects of air pollutants when there's compromise in the quality of air. Next slide. We can also have effects on the cardiovascular system. It's been proven that it increases the risks of heart diseases. It can also contribute to elevation in blood pressure, which can lead to hypertension. And we know that where there's hypertension, there's also likelihood for stroke cases. It can lead to the risk of stroke and other cardiovascular events. And it also compromises heart function. So all the cardiovascular issues can arise from exposure to some of these pollutants. Next slide, please. There could also be neurological effects like cognitive impairment from air pollution. We can have neurodevelopmental disorders, especially in children who are exposed. We can have increased risk of dementia, especially when you have long-term exposure to this pollutant. And neurological effects could also lead to behavioral changes because the cognitive impairment results. So this can lead to behavioral changes in people affected. It can lead to mood swings and other neurological behaviors which may not be termed as normal. Next slide. So we can also have reproductive impacts. We can also compromise reproductive health. Fertility issues have been proven to arise from poor air quality exposure. It leads to fertility problems and reproductive problems. Women who are also exposed, especially pregnant women, is also shown that it can lead to complications or adverse birth outcomes in children. It can also lead to birth defects when toxic pollutants are involved. Then we can also have infant health effects in terms of respiratory and other developmental issues in children who are exposed to this air pollutant. Next slide. So overall, we can have pollution in our air affecting public health in several cases. If we have all the issues we have talked about occurring, it means that it can increase healthcare costs overall. People would need to spend more to be able to take care of their health. It will also reduce life expectancy because the more people get sick, the likelihood of them not really living for a long time. And so it can affect their health and life expectancy. We can also have social and economic burden because more people will need more money, spend more on our social health services. And this could also affect us economically. Then we have vulnerable populations would also be affected, particularly those susceptible to the health impacts of air quality. Next slide. How do we improve significance of monitoring air quality? Next slide. If we monitor the quality of air, it has very good significance. It has health implications because when we monitor, it's very crucial for us to understand the impact of health on us as human beings. And so we'll be able to take steps in terms of health programs that we can adopt in order to mitigate the impact of air quality on our health. So when we monitor air quality, it also helps in regulatory compliance so that people will comply with the standards and regulations, especially policy makers will understand the gravity of the situation and would employ people to accept those laws and regulations that have been set to mitigate the impact of air quality on us. It also has an environmental impact. When we monitor air quality, it helps us to be able to assess the impact of pollution on the environment. So the next is on technological advancements that we talked about, sensor innovations, data analytics, remote monitoring of air quality. And now, as we saw in the Barcamp in Yeboah, now mobile applications are being used to monitor quality of air at various locations in the country. Next slide. So there are a lot of technology also being developed to be able to support in this drive. There are a lot of global initiatives that helps in supporting and improving air quality. International collaborations are very important. Policy interventions, also research and innovations from research institutions, among others, and also public health campaigns like what Clean Air Ghana is doing. Next slide. So there are several economic implications of monitoring air quality, the cost of air pollution, also investment opportunities, productivity and healthcare costs, and other economic development. I think we talked about this in the consequences or importance of monitoring air quality. Next slide. The community engagement we talked about involving the citizenry in all the issues, local advocacy groups, collaborative partnerships, educational programs, and all these are going to help to create awareness by engaging the communities to be able to take steps that would mitigate this pollution of the air in our environment. Next slide. So several ways exist for us to be able to improve on air quality, reducing emissions by promoting the use of electric vehicles, implementing clean energy sources, enforcing emission standards, and also reducing industrial emissions are various ways we can reduce the emissions. Next, we can also promote sustainable transportation by encouraging the use of encouraging public transportation, where a lot of us will park our vehicles and we at least the pollution will reduce if we use less vehicles. Then also development of a bike-friendly infrastructure where people can resort to biking instead of using vehicles that will emit pollution into the air. Supporting active transportation by walking, cycling, among other things, and implementing carpooling programs so that it will reduce the number of vehicles on the road, leading to reduced emissions and improving air quality. Next slide. All this will promote sustainable transportation. Then we also reduce indoor air pollution by improving ventilation systems in our homes. We can also use air purifiers in our homes or in other indoor places. Also avoid smoking indoors and then reduce chemical cleaners, or the use of chemical cleaners by either resorting to alternatives that can reduce the pollution, the air, or in the indoor environment. So this will reduce indoor air pollution. Next slide. As we also mentioned, we can also resort to the use of clean energy in our dwelling places. Then we can also conserve energy by improving home insulation, using energy efficient appliances, promoting energy conservation, and also adopting sustainable building designs would also help. Next slide. Then raising awareness and education is also very important, and we've talked extensively on how we can do that by engaging the communities in some of the policies that have been provided, promoting environmental literacy, educating on air quality importance, and also encouraging communities to get involved is very important. Next. So all this, if we take it serious, and this will all involve also government commitment and the rest of the populace, and then we shall achieve a clean air environment for all. Thank you very much.
I think one of the key things that I picked up was your insight, your perspective on the fact that we don't have a choice but to breathe polluted air when we're in an environment that's heavily polluted. So that's something that's really stuck with me. Are there any questions on the floor for Muizz quickly? Maybe we can take just one question. Okay, if not, then I will hand over to Kelvin to take us through his presentation as well. Over to you, Kelvin.
Okay, thank you, Gamini. Okay, so my name is Kelvin Yeboah. I'm the project coordinator at GHA and then Breathe Accra. And then I'm also a research assistant at the Public Health Research Group in the Department of Biomedical Sciences at the University of Cape Coast. Thank you for the opportunity to speak on air pollution and then health. And then I'd like to thank our first presenter for a comprehensive insight into air pollution, as well as the sources and other things about air pollution. The narrative is not entirely different from what the first presenter mentioned or touched on. But then I would like to narrow it down to our ambient environment. That's our outdoor spaces, the air pollution there, and then the effect that it has on our health. Okay. Yeah. So just something to think about. So working outdoors normally they spend around 8 to 10 hours outside their homes on weekdays. That's from Monday to Friday due to work. And then school-age children and teenagers also often spend around 6 to 8 hours outside their homes on weekdays attending school, not including extracurricular activities or socializing with friends. But then on average, the adults may spend 8 to 10 hours outside their home on weekdays and more, even more on weekends, while children and teenagers also spend slightly less time during the week, but more on the weekends. So in conclusion, we tend to spend a lot of our time outdoors. Even though we go back to our homes, we spend a lot of time outdoors during the weekdays, going to work, going to school, and then even more on the weekends where people are going for parties, visiting family and friends, going to church, and other outdoor activities. So it's very important that you know the quality of air at these outdoor places. Now, air pollution, we've defined air pollution several times, so I guess everybody now understands what air pollution really means. But then just to go over it, air pollution simply refers to contamination of the indoor and then outdoor air. Now, we've termed the indoor pollution as household air pollution, and then the outdoor pollution as ambient air pollution. Now, ambient air pollution is a major environmental health problem, and then it affects everyone across lower and then middle and then high income countries. But then as we go on, we'll get to know that there's a disproportionate effect when it comes to the health problems that it comes with. According to WHO, ambient air pollution in both cities and rural areas was estimated to cause about 4.2 million premature deaths worldwide in the year 2019. So just 2019, the WHO estimates that about 4.2 million premature deaths occurred due to outdoor air pollution. Now, we are not necessarily saying that ambient or outdoor air pollution is directly responsible for all these premature deaths. But then one way or the other, it has been proven to be highly linked with these deaths, indirectly or directly. Now, the combined effects of ambient air pollution and household air pollution, according to the WHO, are associated with about 6.7 million premature deaths annually. So around the world, annually, we have about 6.7 million people dying from the combined effects of both outdoor and then household air pollution. Now, just like I stated, out of this 6.7 million premature deaths, in 2019, we had about 4.2 million of those deaths occurring basically due to outdoor exposure to air pollution. Now, just like I mentioned that there is a disproportionate effect when it comes to air pollution, where we have people in low and middle income countries being greatly affected or burdened by the effects of outdoor air pollution. And then, in fact, the WHO also estimates that around 4.2 million premature deaths, or about 89% of the 6.7 million premature deaths that occur annually, these deaths occur in low and middle income countries where Ghana is part. So as you are seeing the numbers, it's a very big issue. Now, We can turn our attention to the sources of outdoor air pollution. Now, we can trace outdoor air pollution to sources such as point sources. So you have sources that release pollutants into the air, including power plants and then industrial facilities, etc. Power plants, especially in countries where they have erratic power supply, like we are experiencing quite recently, because some of these power plants are diesel-based, they tend to pollute the environment or cause or release a lot of pollutants into the air. And then area sources such as gasoline stations and dry cleaners over a large area contribute also to outdoor air pollution. And then we have mobile sources, as our first presenter mentioned: cars, trucks, airplanes, boats, ships, off-road vehicles, etc. Now, when you come to Ghana, especially in Accra or these urban areas, vehicular emission or pollution is top. When you talk about the top 5 or top 3 sources of air pollution, vehicular traffic explosion, air pollution is among these top 3. And then we also have natural sources like wildfires, wind-blown dust, volcanoes, and then vegetation fires. But then, fortunately for us, in our part of the world, we hardly see volcanoes and then wildfires. So to summarize for you, in the picture, we have some major sources of air pollution in cities in Ghana. Some of these sources, you can find almost all of them in one urban city in Ghana or a multiple of these sources. So in the first picture, you have these tricycles, Yeboah, Pragya. They are virtually taking over our roads nowadays. When you go to Kumasi, and then even in Cape Coast, where I am at the moment, you will see a lot of these Pragya around. And then also Yeboah. Now the Yeboahs are helping us with our waste problems. They come for the waste, but in as much as they are solving one problem for us, they are also causing another one for us, because these tricycles are 2-stroke engines, so they tend to pollute a lot. And then trotro, very old rickety trottros, especially in the city of Accra. I don't know how many of us have experienced taking Trotskys in Accra. You can see a vehicle that's even as old as one's parents or grandparents. We recently had a workshop, an air quality awareness week. And then in one of the sessions, we had a roundtable discussion with GPLTU and other stakeholders like Urban Roads, DVLA, and then EPA. And then I got to know that some of the Trotskys or buses in Accra are as old as 50 years. As old as 50 years, and they are still on the road. And then you have the Okada problems as also very prominent. And then the e-waste recycling. This was really prominent at Abublushi, where we had a e-waste recycling, where you have these guys burning electronic waste, trying to get the copper and other materials out of it. They really expose themselves to a cocktail of air pollutants. And then you have unpaved roads. In Accra, it's not really common. This is normally common in rural areas, but then it's also a major source of air pollution. And then recently there's a road construction going on at the Amasaman area. And then the residents there are really, really complaining about the dust pollution. And then you have street cooking with biomass fuel. So all these kebab sellers, those who sell kinky, they rely on biomass fuels, charcoal, firewood as source of fuel for cooking. And then our age-old problem of waste management, where the waste will collect for a very long time without the appropriate authorities coming for it. And then open burning of waste in our homes. This has become more like a culture at the moment. A lot of people burn a lot of waste. Every day, people are burning waste. In the evenings, while you are sleeping, people are busily burning waste. And it's a health hazard. And then you have our mothers, normally in the coastal areas, who are into the business of fish smoking. They heavily rely on biomass fuel for cooking. And then they expose themselves as well as their children. Some of these women, sometimes they are pregnant and then they are still going about their duties. Now, I want you to know that after their release, air pollutants undergo a number of chemical and then physical processes. These processes normally will determine when, where, and how they move through the environment. So if we are in the dry season, because the weather is a little warm and then these particles are, they have lower masses, they are always suspended in the atmosphere. And you will breathe in a lot of these as compared to when we are in the rainy season, when the rains force them down to the ground. Exposure to outdoor air pollution. Now, human exposure to outdoor air pollution is a function of both the composition of the pollutants and then the magnitude of the air pollution combined with other human activity patterns. So, like we said, we have about, WHO has about 6 criteria pollutants that they look out for. They believe these pollutants are very dangerous to human health. And even within these 6, some pose higher danger. For example, the PM 2.5, they pose a higher danger to your health, your cardiovascular health, your nervous system, and other body systems. Now, determining exposures to outdoor air pollution requires a complex assessment of factors. Assessment that factors into the amount, the types of air pollution, the number of people exposed, and then the exposure duration. So you don't just sit down or just one day you are in a car and then fumes from the next car or the car in front of you, and then you are able to determine that I've been exposed to this amount of air pollution. Actually, there are complex assessments and then factors all these things, the amount that you are inhaling, the types of air pollution. So if you are in traffic, you are likely to be exposed to more of the SO2 and then PM 2.5. The SO2 from the fuels that the cars are burning, as well as the PM 2.5. And then also the number of people exposed, and then also the exposure duration is most importantly, the exposure duration. Now, typically studies that aim to model or relate air pollution to health outcomes, normally they employ a combination of assessment protocols or tools or methods. Now, it will include personal exposure monitoring using devices like the UPass, and then also complemented by stationary low-cost sensors or other monitoring sensors, or even remote sensing technologies or satellite data from, example, the Copernicus system or the NASA data. So before we actually correlate or try to model health impacts, exposure impacts to health, you need, one would say, a vigorous assessment protocol to be able to arrive at a conclusion that exposure is related to this particular health outcome. Now, in pictures, you will see some of the devices that we use. So you have some of the low-cost sensors. On the first one, we have Clarity Air, Clarity Node S, and then we have also Air Nodes, which are low-cost sensors. These are stationary low-cost sensors or air quality monitoring devices. And then in pictures, these are pictures from one of our current research going on in schools. So where we are trying to look at the effects of air pollution on children. So we are doing personal air monitoring in these schools. The school on your right is a Presby school at the Ebri, and then the school on your left is the Anglican school at Kwashiman. So we are doing this to be able to see if the air pollution, the levels that they are exposed to while they are in school is related to their health. Outdoor air pollution and health, a number of factors determine whether people are harmed by poor air quality. And these include, just like I mentioned earlier, the level and then the mixture of pollutants in the air. So now we have about 6 criteria pollutants. We have ozone, we have PM 2.5 or particulate matter. We have SO2, that's sulfur dioxide. We have NO2, nitrogen dioxide. We have carbon monoxide, and then lead. Now, the WHO, another factor is exposure doses. So the dose of exposure that you are exposed to will determine whether you are affected, you are harmed by it or not. Now, typically the WHO recommends that for 24-hour exposure, the level that's for PM 2.5, your 24-hour exposure should not exceed 50 micrograms per meter cube. And then your annual exposure should not exceed 5 micrograms per cubic meter. So at these levels, they've done several risk assessments, and then they've come to the conclusion that at these levels, people tend to feel the effects of air pollution. So sometimes, but it's not always the case that at these levels, sometimes even as low as 2 micrograms per cubic meter can cause a reaction in somebody because our systems are different. Another factor is durations of exposure. But then you have to note that when we talk about duration of exposure, both long-term and then short-term exposure to air pollutants have been associated with adverse outcomes. So whether short or long-term exposure, you may experience some health or adverse health outcomes. And then the last one, individual susceptibility and then underlying diseases. Some people already are suffering from stroke. Some already are suffering from cardiovascular diseases and then other respiratory diseases like asthma. And then people, sometimes by virtue of their age, they are already susceptible to the effects of these pollutants. So a combination of these factors will determine whether someone is harmed by poor air quality. Now, let's talk some numbers. So the most extreme effect of outdoor air pollution and then household air pollution or air pollution in general is death. The most extreme is death. Now, this infographic is from the WHO, where we have about 7 million people dying prematurely every year That's like this is the current statistics. According to the WHO, 7 million people die prematurely every year from air pollution. That is both household and outdoor. And then among these deaths, you have 21% being due to pneumonia, 20% from stroke, and then 34% from ischemic heart diseases, and then 19% from chronic obstructive pulmonary diseases, and then 7% from lung cancer. So just like I was saying, death is the extreme effect of air pollution, and the numbers are visible for all to see that air pollution is indeed an issue. Now, the first speaker has touched on the effects of air pollution. What I want to say is that looking at this picture, you can come to the conclusion that air pollution affects virtually every organ in your body, from your cardiovascular system, your nervous system, reproductive system, respiratory system, endocrine system. Your entire body is at risk of air pollution. So skin irritation, cough, breathing, and then breathing difficult. Some of these symptoms, we feel them, we are able to see them. Some of them too are silent. Yeah, for instance, the stroke, just one time, and then you have stroke, and then you'll be wondering where this came from all of a sudden. So sometimes they refer to air pollution as a silent killer. To be killing you, you wouldn't know. Just like I was saying, your nervous system, for instance, your cognitive decline in the elderly, autism, stroke, impaired psychological development in children. So some children will be growing up, they are very dull, and then we tend to overlook all these things. We tend to religious or other spiritual causes or possible causes. So yeah, in short, air pollution, it affects almost your entire system. And then there have been increasing reports that implicate air pollution and then its adverse effects on the human health, the cardiovascular, lung, and then the CNS. But then the mechanisms through which these things occur are largely unknown. But then I can assure you that there are still research going on to unravel the biological mechanisms and that underlines some of these effects. More evidence, ambient air pollution. This is a paper that was published about more ambient air pollution and low birth weight. Just like I said, pregnant women are affected, and then our first speaker mentioned it. You have pregnant women giving birth to low birth weight babies or small for age gestation babies, even premature births, and sometimes fetal deformities. This is another paper that was published on the ambient air pollution and the risk of birth defects. And then there's also another paper on the effects of long-term exposure to traffic-related air pollution on respiratory and then cardiovascular mortality. Another paper on air pollution at menopause age. Another one on mental health. So the evidence is a lot. The evidence is a lot. But then, just like you saw, the majority of this data on health impacts of air pollution greatly emanates from the West and then the global North. Just like the conversation have been going on, there's limited research in air pollution when it comes to sub-Saharan Africa or the African continent. the air pollution health impacts in Africa are mostly estimates rather than actuals. So the figures that the WHO mostly put out, they are not really actuals, but then they are estimates. So these things are occurring because, one, limited monitoring capacity, lack of surveillance for air pollution related diseases. So our first speaker mentioned something about health impact assessment. There's little on that. So people go to the hospital, they are suffering from COPD, and then medical doctors or medical officers, they just be looking somewhere else. They don't factor the environment the person lives to assess the person's exposure to air pollution. And then also inadequate funding of air pollution research in Africa. So all these things are going against us in Africa here. I would like to touch on how to protect ourselves against air pollution, the health effects of air pollution. The first thing I'll touch on is improving our diet. So you can increase vitamin E rich foods such as sunflower seeds, sunflower oils, almonds, peanut, and then peanut butter. These contain sources of vitamin E. They are rich sources of vitamin E. And then also you can increase your vitamin C rich foods such as fruits and vegetables. The citrus fruits like oranges, lemon, grapefruits, vegetables like tomatoes, bell pepper, broccoli, white potato, etc. And then you can also increase your selenium intake with foods such as beans, lentils, beef, turkey, chicken, and then whole white bread. Also, omega-3 rich foods such as oatmeal, eggs, brown rice, pork, etc. And then increase vitamin D rich foods such as egg yolk, fatty fishes like salmon, sardines, mackerel, butter, and then fortified margarine. Now, these foods that I mentioned, they are very good sources of antioxidants. Now, these pollutants, the PM2.5, the SO2, the NO2, the ozone, they are mostly called free radicals. So when they enter your bloodstream or your body, they are free radicals, and then they are very reactive. So when you take a lot of these antioxidant-rich vitamins or foods, they tend to neutralize these free radicals through various mechanisms. Here, it's a little bit technical, so I'll just mention them. Donation of electrons, scavenging of free radicals, and then regeneration of even other antioxidants, and also activation of antioxidant enzymes, and then chelation of metals. All these tend to protect us from the adverse effects of air pollution or the air pollutants that we are breathing in. So a balanced diet in fruits, vegetables, nuts, seeds, and whole grains can actually provide a variety of antioxidants that will support our overall health and then well-being. And then other things that you can also do to protect yourself is use face masks. Yes, COVID came and then it forced all of us to use face masks, but I think it's a good thing. And then one other important thing you need to be doing now often is to check the air quality in the location you are going to before going out. So you can visit our website, breatheaccra.org, where we have sensors in Accra and other metropolitan areas in Ghana. Check the air quality index before you go out there. If it is very important that you go out, then you max up. If it's not really important, then you stay indoors. Also, you can avoid jogging, cycling, and other outdoor activities, especially when the air pollution levels are at peak. But then let's not confuse ourselves with avoiding these things, and then also promoting active travel, like cycling and other things. Here, you need to take precautions. Don't do these things when the air pollution levels are peak. And then also, we need to avoid burning waste at home. The waste burning is a lot. Wherever you pass, someone is burning something. And then you should try and avoid using biomass fuels for cooking. Improve ventilation at home. Some of the kitchens and then even our bedrooms, the places are too stuffy. We have old things that we are supposed to discard. We are still holding on to them. And so there's little fresh air coming into the room. All these things are things that we can work on. Now to end, I would like to say that whilst we continue to hope and wait that major interventions like improved road network, efficient waste management system, efficient public transport system, and even improved monitoring capacity is achieved, we all have the responsibility to help improve the quality of air that we breathe. So the little things that we said here, avoid burning waste, avoid using biomass fuels and other things, service your vehicles. They all are small things that we can do whilst we wait for major intervention. And then also we need to protect ourselves and then our loved ones, especially those within the vulnerable group brackets from the negative impacts of air pollution by taking precautions such as improved diet and then improved physical activity, which also has a public health co-benefit of improved cardiovascular health. Now, to finally conclude, we all need to remember that there is no alternative to clean air. So let's all work to ensure that the air we breathe is clean. Thank you.
Awesome. Thank you very much, Kelvin. This was a great presentation. I think we've had two really fantastic presentations today from our air quality champions. So much appreciation to you for this excellent job. So I'll now open up for questions from the floor. Feel free to turn on your mic and ask your question to our air quality champions. If you have comments, feel free to drop them. And if you rather just type your question in the chat, also feel free to do so and we'll flag the questions for them. Thank you. Okay, so whilst waiting for the questions, so I was making some notes just from Kelvin's presentation. So my first comment was that I like the hyper-local focus on sources. So when you were presenting about causes of air pollution, you mentioned certain specific things that were unique to cities in Ghana, burning of rubbish, use of solid fuels, the effects of Yeboah and other types of vehicles, e-waste. E-waste is one that I'm really concerned about, all of those. And then I just posted a link. So there's this project called Agboglish Makerspace project, which was also looking at how people can safely process electronic waste. It was active a couple of years ago, so people can visit the link that I posted in the chat just to read more about this. Somebody commented, he didn't put his real name, but his administrator on the call. He says air quality is probably contributing to increase in stress, anxiety, and depression. I think that's true. So I will turn this over to our speakers if you would like to touch on that, the link between air quality, stress, depression, for us just to touch a little bit more on that. Thank you. From my point of view, I mean, one area that is certainly true is even when we see people burning rubbish in our various communities, and we know that we are going to be exposed to air pollutants, that automatically makes me worried. I know that, of course, it's not a direct connection, but that's just one angle that really should not be missed at all. Okay, so I think I would ask a different question, and it's around how is our health system in Ghana really plugged in when it comes to this issue of air pollution, given that the health impact is so obvious and we're already suffering when it comes to deaths and when it comes to increases in certain types of diseases. How aware is our health system, and are there any specific interventions that they are already putting in place to either mitigate the negative aspects of air pollution, or even just contribute in terms of as a general public health effort in terms of reducing air pollution itself directly? So I'll invite Kelvin to take us, and then after this, Abdul Muizz can also share insights.
Yeah, sorry. About the first question, you something on mental health and then air pollution.
Yeah, stress, depression, and air pollution.
Yeah. So what I can say is that I can even count about 10 papers on the air pollution and then mental health or any psychologically related disorder like anxiety, psychosis, and then the rest. But then just like I was saying, in Africa here, we don't really tend to do a lot of research in these areas. But in the global West and the North, you tend to get some of these studies where air pollution is affecting even the number of times people step out to go and enjoy these green spaces like parks and other beautiful sceneries. So whilst people are not able to freely step out and then they are home, they are not doing anything, it's also a source of anxiety or depression. So that's my view on that. And then the next question was on our health system. So just like I mentioned that there's limited health impact assessments when it comes to air pollution. People don't normally look out for air pollution as a possible cause or related to conditions. When people come to the hospital presenting these symptoms and things, I think the best we can do is to we can include questions on looking at the person's environment to see if the person is exposed to air pollution. Some people actually live in industrial areas. People also live in the highly polluted areas. A lot of burning goes around some of these areas. And then they contribute, as we've seen, they contribute a lot to some of these things. They have been implicated in respiratory diseases, asthma, cardiovascular health, even mental health, like we are saying. So I believe it's a wake-up call for our health system to try to adjust, because air pollution is now a major topic. And if in the past we didn't know that it was connected to this or that condition, at least now evidence is starting to come in. So our health systems should set up and then include some of these things in their impact assessment.
Okay, thank you very much, Kelvin. So, Abdul Muizz, so just a follow-up question for you for your consideration. So, in terms of talking about air pollution and health, engaging people on this topic, what would you suggest to be some of the key messages that can be transmitted? Like, when, for example, as community leaders or social media influencers, what are some of the key messages that we can use in our advocacy?
So thank you very much. I think we can talk about what we can do as a people. Simple things that we can do as a people in terms of whether planting trees and also messages relating to our solutions to the campaign, like we're having insecurity. See some messages that get other people in society about what we can all do in order to ensure that we have good air quality in our environment.
Do we have any more questions from our participants, or any comments, inputs? Because I think this topic is probably one of the most interesting ones. Air pollution and health is always like a direct link. Any questions or inputs? Okay, it looks like we don't have any more questions or inputs. So I think at this point, I would just like to say a very big thank you to our two presenters and invite them if you have any final parting words for us, Kelvin and Abdul Muizz, who we seem to have lost. Please, yeah, I'll invite you to give your final parting words.
Okay, so the last bit I want to say is that just like our first presenter mentioned, that you don't have a choice when it comes to air, the air that we breathe. So let's all try to do something one way or the other to improve the air that we are breathing in. And then always remember that clean air, there's no alternative to clean air. Thank you.
Okay, thank you very much, Kelvin. I'll just re-echo your words. There's no alternative to clean air. Thanks so much for sharing with us. Look forward to the next workshop for this series, which will be focused on looking at how we can improve the situation as far as air pollution is concerned through policy and advocacy. This will be led by air quality champion Doris Agbavivi. So we'll share the details with you in due course. Thank you very much for joining us and have a brilliant evening. Thank you.